The final type of antidepressant we'll cover here in Part H is MAOIs, monoamine oxidase inhibitors. These are rarely used. You will see them occasionally. It's more important to understand the complications of using MAOIs. They're very effective, but they're not the first line of choice because of the dietary implications and their need of strict adherence. And when people have to change their diet, people don't want to take the medication. These are used for people that are not responsive to tricyclics. They have a potential to cause a hypertensive crisis when taken with tyramine. Where is tyramine? We'll get to that in just a moment. So it's used for depression. If you give MAOIs to the person who's getting Demerol, which is a painkiller, Demerol is a brand name, generic name is meperidine, it can cause hypertension, convulsions, and coma, hyperpyrexia, restlessness, and so you will avoid that. When taking antidepressants, we're going to avoid alcohol, cold and flu medications. If a person has an MAOI overdose, the symptoms will not appear for 12 hours. And those symptoms will be tachycardia, circulatory collapse, seizure, and coma. You might try gastric lavage to flush it out of the system. Might try urine acidification and hemodialysis to physically filter the chemical out of the blood. Side effects, seizure and hypertensive crisis are the biggest and worst, but there are many, many side effects with MAO inhibitors, especially, again, when we talk about tyramine. And tyramine is found in foods. And again, when you start telling people what they can and cannot eat, some people will resist and cause a problem. Alcoholic beverages, specifically beer, is a big one. Red wines, figs and bananas, smoked or pickled or aged meats, fish or poultry, so sausages, herring, corned beef, salami, pepperoni, aged cheeses, like a good old cheddar or blue cheese, Swiss cheese, sauerkraut, gravies or sauces that contain meat extracts, such as bouillon or beef broth or soy products. That's a huge list of the foods people love, which is why MAOs just are not used that often. People have to adhere to a strict diet or risk hypertensive crisis. Hypertensive crisis is the #1 biggest side effect of MAO inhibitors, and orthostatic hypotension. I know, the exact opposite. If you can't follow your diet, you could trigger a hypertensive crisis. But on any given day, you may experience orthostatic hypotension. You stand up, you get lightheaded and dizzy. MAOIs are just not used that often anymore because of the side effects. Other things that need to be eliminated: you must eliminate other antidepressants, decongestants, allergy and hay fever remedies, opioids, especially that one that I mentioned before, meperidine, weight reduction medications, cocaine, well, probably should all reduce cocaine, and asthma remedies. MAOIs work on depression, but only if every part of your life is under control. It's very difficult, very difficult. What is a hypertensive crisis? Extreme increase in high blood pressure. You're going to develop an occipital headache, neck stiffness, palpitations and tachycardia, nausea, vomiting, and diaphoresis. The treatment, you're going to stop giving the MAOIs. Hold the MAOI, gastric lavage, urine acidification, and administer hypotensive drugs. So what will you be watching for when you administer those MAOIs? Blood pressure, pulse, nausea, vomiting. You're just going to observe that, and you're going to observe and monitor what they eat. It takes about 2 weeks to wash out of their system before you can start a tricyclic or an SSRI. Without the washout period, if you stop the MAOI and start the tricyclic or the SSRI, you will experience hypertension, hyperthermia, delirium, convulsions, and coma. So there must be a 2-week washout period. We will always assess for mental changes or changes in behavior, suicidal ideation, signs and symptoms of a hypertensive crisis, which we just covered. Restrict amount of drug available to the patient. Again, we'll never leave it at the bedside. Monitor appetite, nutritional intake. Monitor blood pressure, pulse before and during therapy. Sexual dysfunction. Peripheral edema or urinary retention. We will give this in the morning. And we'll monitor liver functions and glucose level. Patient teaching. For this medication, patient teaching is really important. We need to make sure everybody watches out for suicidality, especially early in the therapy. That you may not see any drug effects for 2 to 4 weeks. Do not stop abruptly. May cause nausea, vomiting, diarrhea, headache, trouble sleeping with vivid dreams. Change position slowly. Remember, orthostatic hypotension is common. Avoid alcohol. No herbal supplements. Can cause dry mouth or blurred vision. But if it lasts more than 2 weeks, we need to notify the doctor. Monitor dietary intake, and that should probably be the first or second patient teaching. Dietary intake has such a profound negative effect on MAOIs. So, are herbal and dietary supplements effective in treating depression? We talked about it treating sleep, but can we take an herbal supplement for depression? Well, St. John's wort is probably the most commonly known herbal supplement for depression. And research shows that St. John's wort interacts with many medications in ways that can interfere with the intended effects. So St. John's wort will interact with antidepressants and birth control. Cyclosporine, which prevents organ rejection from transplants. It can affect digoxin. And many other medications that treat HIV and cancer. Seizure control agents it will affect. And it'll affect anticoagulants. So it's simple herb, which seems so safe. If you're on other medications, it can be a big problem. Now, some studies have reported benefits for depression and others have not. A large study sponsored by the NCCIH found that the herb was no more effective than the placebo in treating major depressions of moderate severity. And a study that was co-funded between the NCCIH and the National Institute of Mental Health also found that neither St. John's wort nor a standard antidepressant medication relieves symptoms any better than a placebo. So, will it work? Maybe. Might. Side effects? Depends on the person. If the person's taking a lot of other medications, there's a risk of major side effects. It can cause serotonin syndrome also, by the way. So if a person is thinking of taking St. John's wort, make sure you tell your doctor so that your doctor or pharmacist can look at all the medications and look for potential interactions and side effects. Come back for the next section. We will be talking about acute mania. No, we're going to talk about acute mania right now. Mania is labile moods, meaning rapidly changing moods, flights of ideas, racing thoughts, and people that are in a manic phase, they're loud, they're intrusive, it could be angry and hostile, irritable, grandiose ideas. They have ideas to fix everything, and they go from idea to idea to idea to idea, and the ideas just are pounding, running through their head really fast. Obviously, decreased attention span, very distractible. They're restless, pacing, increased hyperactivity. They have outbursts of anger and hostility, and markedly decreased eating and sleeping. Sometimes people in a manic phase can go for days, nonstop. So what are we going to use for anti-manic agents? Well, lithium carbonate is the most common. Now, we can also use other ones. Benzodiazepines, anticonvulsants, and atypical antipsychotics can also be used. Lithium takes about a week before it has an effect, and it's used for long-term therapy. It's used both for mania, that's the hyperactive, racing thoughts, non-stop go portion, and the other half, the depression. Nobody really knows how lithium works. They think it alters the ion transport in the nerves and muscles, causes reuptake of serotonergic neurotransmitters, but nobody is totally certain. Serum levels must be monitored twice weekly during initiation of therapy, then every 2 to 3 months during chronic therapy. A very narrow therapeutic index. Lithium decreases sodium reabsorption in the renal tubules, which leads to a risk of sodium depletion in the body. So many of the side effects of lithium are cardiac arrhythmias, polyuria, and edema as a result of the lithium's interaction with sodium and potassium. If you remember your periodic table, sodium, potassium, and lithium are in that same column. So there's similar effects in the body. Enhanced sodium depletion also enhances lithium toxicity. Signs of lithium toxicity include nausea, vomiting, abdominal pain, diarrhea, lethargy, dizziness, muscle twitching and tremor. Remember, it's similar to potassium, and potassium is used for muscle control. You need to have a good diet to decrease the chance of sodium depletion. Must have an EKG evaluation. So what are some side effects? Dysrhythmias, seizures are the biggest and most dangerous. Muscle weakness and tremors and leukocytosis are also very important. Fatigue, slurred speech, hypotension. We're looking at a lot of heart-related problems, but also muscle. If they're dehydrated, that's a contraindication. You already have an altered sodium level. If they have severe cardiac or renal disease. If they're on medications, if they're on the diuretic, which is going to already cause sodium depletion, you're not going to want to use lithium unless there's modifications made. Salt intake must remain relatively level. Not too much, not too little. And fluid intake should also be monitored, again, because we don't want to flush the sodium out of the system. So those are medications for mania, lithium mostly. Come back for psychosis in the next section.